And if you have questions about the Care Mentor program, I'm happy to answer those questions. All right, thank you, Dr.
Hi, everybody. Thank you for coming. Before I start, just to give me an idea, how many people are here because they have a child, grandchild, or other relative on the spectrum? Great, most of you. How about any teachers, professionals who work with people on the spectrum? Okay, great. Excellent. Thank you. So let's just get started. So what is autism anyway? Let's start with definition. So it's a syndrome. It's characterized by difficulties with social interaction, difficulties in communication, language, and restricted, repetitive, and stereotype patterns of behavior. It means they tend to do the same thing over and over and over and over, like stacking blocks the same way, knocking them down, stacking them over the same way. Restricted patterns of interest and behavior. We had, in the past, there's something called the Autistic Spectrum, which is not actually part of the official diagnostic way we do it anymore, but it's good to know. So there was sort of classical autism, which is the autism that you're mostly familiar with. Then there's autism spectrum disorder, which meant kids with atypical symptoms, maybe milder. And then something called Asperger's syndrome, which is a kind of high-functioning autism, which some people think is the same as high-functioning autism, but some people think it's actually a different thing. Now, and then there's something called PDD that some of you have been around a while and maybe some of your children have been diagnosed with. All of those are gone. Right now you either have autism spectrum disorder or you don't, from an official point of view. But a lot of us will still use especially Asperger's syndrome. As many of you can know, autism is getting more and more and more common. It's just shockingly common. Back in the 1960s, it was 5 or 6 per 10,000, right? So that's 0.5 per 1,000, 0.05 per 100. Very rare. Nobody even saw it. Now it's the latest Center for Disease Control statistics. It's 1 in 68. More than 1 in 100. And I've even seen higher estimates. So it's now becoming one of the most common developmental problems we see. So what causes autism? The short answer is we don't really know. But let me tell you something really important to remember about autism. Autism is what we call a phenotype. You don't have to remember that word. But what it means is we're describing a set of behaviors. And it's kind of like a fever, right? If you go to your doctor and you have doctor says he has a fever, well, that doesn't tell you what the fever is caused by, right? It could be caused by strep throat, could be caused by the flu, it could be caused by being in a locked car for too long. It's just a description. And autism, in a strong way, is like that. It's a description of a set of behaviors which could come from lots of different biological causes. And so that's really important because it means when we treat autism, our treatment might not work the same way for every kid with autism because they may have very different reasons for having autism. We'll be talking about lots of those reasons, but the important thing to remember is not every child with autism has the same cause. They're not the same. They won't react the same to the same kind of interventions. Maybe someday we'll have much better idea. You know, we have this type of biology and that type of biology, but right now we don't have it. So, what happened? Why does autism happen? Well, we know there's a genetic predisposition. So that means it to some extent can run in families. But it's not just one gene or 2 genes or 3 genes for the most part. It's a whole set of genes probably, and we've only been able to sort of identify abnormal genes in a very small proportion of kids with autism. Most of the kids we see with autism, we can't identify what about their genetics is abnormal. We do know if the same set of parents has a child with autism, they're like way more likely for their next child to have autism. So we know there is some genetic. But then there's environment. There's all kinds of environmental influences that seem to be associated with autism. So what are those things? What are those environmental influences? Here's a bunch of them. In the prenatal period, while women are pregnant, there's exposure to certain toxins. There's certain medications. There's certain illnesses that can predispose to autism. There's nutritional deficiencies. I'm going to be showing you some of these in a few minutes. Then during the time around the birth, prematurity makes autism more likely. C-sections make autism a little more likely. And then after they're born, in their infancy, toxin exposure again. Too many antibiotics seem to be associated with autism, certain nutritional deficiencies. So you have the genetics, then you have the environment, and together those can cause autism. So here's just one example, mercury. Now many of you have heard of mercury in terms of the vaccines, which used to have mercury and people thought they caused autism. Well, there's no more mercury in the vaccines. It's been gone for like 16 years. So that's not the issue, or there's very tiny amounts. But actually environmental autism, mercury, the stuff that comes out of smokestacks in factories can increase the rate of autism. In this study, for every 1,000 pounds of environmentally released mercury, there is a 43% increase in the rate of special education and a 61% increase in the rate of autism. So that was just being exposed to the mercury in the air. And other toxins can probably do that as well. Here in California, people in the Central Valley who are exposed to high levels of pesticides, we found that in this study, 6 times as much autism happened with moms who are within 500 meters, which is about 500 yards, of spraying. So, and unfortunately in the Central Valley, everybody is exposed to these pesticides. They spray on in the fields, it gets into the houses, it gets into the clothes. So we have this much higher rate of autism. We don't know how much the kind of pesticides you might use in your home would cause an increase in autism, but I highly encourage everybody to not use pesticides in the house, not use pesticides on your lawn or in your garden or anything like that, because we just don't know. They're poisons. So here's an interesting study that combines nutrition and pesticide exposure. So folic acid is a B vitamin, and if anybody took their prenatal vitamins, they got plenty of folic acid. That's one of the most important things in prenatal vitamins. But a lot of people don't get them and don't take them. So in this study, they compared people who didn't take their folic acid, so with less than 800 micrograms a day of folic acid, and they saw what their rate of autism was compared to pesticides. So if they had low folic acid intake and they didn't have many indoor pesticides, still the rate of autism was twice as likely, just from not taking folic acid. So really important to take prenatal vitamins. If there was low folic acid and exposure to indoor pesticides, now it was almost 4 times as likely that a child would have autism. Now, that's just one study, because we know folic acid is important. How many other vitamins and minerals might contribute to this? What other things could be deficient? There's, many, many vitamins, many, many minerals that are important to us. There's all kinds of antioxidants and things. So we're just at the very beginning of this research. So the bottom line is to decrease the risk of autism, take your prenatal vitamins, eat lots of fruits and vegetables because they have all kinds of vitamins and minerals, and stay away from pesticides. I just threw this slide in because there's something called epigenetics, which is... I just threw this slide in because there is something called epigenetics, which is really important. And that means that we used to think your DNA was your DNA, and that was your genes, and that totally determined everything about you. But it turns out that's not true, that you have your DNA, but environmental influences can change how your DNA is working. So your DNA kind of turns proteins on and off. And when these environmental things happen, it actually changes the way your DNA makes proteins. And that is not only changes for you, but actually that can be passed to the next generation. So we now know that things like pesticide exposure or other things like that can actually not only change, say, a mom's genes, but that baby can then pass those genes on to the next generation. So that's epigenetics. So it's a little scary, and it's very, very important. So the old model, the way most people think about autism, is that it's basically a brain disorder. There's some genetic tendency, the genes affect the brain, and then the brain problems cause these behaviors. The brain problems cause not being able to develop language right and not interacting socially right, and these repetitive behaviors. And then from that model, the only treatment that you can do is therapy. And I think anybody of you who has a child on the spectrum and have been to see people, they say to do what? ABA, speech therapy, occupational therapy, maybe sensory integration therapy. That's what's recommended, and all those are extremely important. However, there's problems with that model. And the problem is that many kids with autism have all these conditions that I've just listed. And I'm betting that many of your children do. They might have GI problems, constipation, diarrhea, stomach aches. They might have inflammation, eczema, asthma. They might have metabolic abnormalities you don't know about. Their immunity might be a problem. They may have allergies. They may have nutritional deficiencies. They may even have mitochondrial problems. Mitochondria, they're little energy factories in your cells. Now, if this was just a brain disorder caused by genes, why would they have all of these different problems? So that's not a good model. So the model that a lot of people like myself are using these days is it's not just a brain problem. You have your genetics and environment, and then you have physiological, biological changes that affect multiple systems, including the brain, and that results in autism. So it's a different model, and I'm going to explain to you some of the evidence that that's true. So you have genetics, you have environmental influences, you have all these kind of disturbances, and then you have autism. So why is that important? Because if autism is an ongoing systemic disease where there's metabolic, allergic, nutritional problems, then if we treat those problems, we may be able to help the actual symptoms of autism. So if we treat the GI issues, sometimes the autism gets better, not just the GI issues. Sometimes we treat metabolic problems, and I'll tell you how we do that. Sometimes not just the metabolism, but then the autism gets better. So just to show some of the ways in which we know that it's not just, that it's a systemic problem, in this study, they actually showed inflammation in the brains of children with autism. Inflammation, just like if you cut your hand and it started to get infected, it would get red. Or if you had arthritis and your wrist got...
People are having a hard time hearing the back?
Whoa, I don't know how much louder I can shout right now. But I don't.
Yeah, that's not a microphone.
No, it's for the filming.
Okay.
I'll do my best. Or people could move up, just move your chairs up.
Come on closer.
Yeah, if you can't hear. I'll do my best to speak louder.
Thank you, Dr.
Anyway, so just like if you had a swollen wrist, it was red and puffy, that's inflammation. They showed there's actual inflammation in the brain of children with autism. So that maybe what's happening in the brain is these systemic problems is causing a disturbance of the way that brain cells operate. And again, if we can do something to solve that metabolic systemic problem, we may be able to help the brain work better. And that's the kind of work I do. So, GI is one of the big ones, gastrointestinal problems. So kids with autism are 4 times as likely to have GI symptoms. They're 3.5 times as likely to have diarrhea. They're almost 4 times as likely to have constipation. They're 2.5 times as likely to have abdominal pain, and that's probably even higher because many of them can't tell you if they have abdominal pain, so you don't really know, but they may be screaming at night, or they may be having fits, and you think it's behavioral, but maybe their stomach hurts, and we don't know why. And it's not just pain, but when we examine it, we actually see significant pathology. That means things we can see that are wrong. So in this study, they looked at kids with autism who did have GI problems, who had some kind of constipation or diarrhea or stomach aches, and almost 70% of them had reflux, esophagitis, that's swelling and pain in your esophagus. And 42% had gastritis, inflammation of the stomach. Duodenitis, your duodenum is the thing that comes right after the stomach, 67%. And as we talked about, so these kids may have swelling and inflammation, and they may not be able to tell you about it. They may just not want to eat, they may just be crying a lot, they may be acting bizarrely. Some of it may be just the autism, and some of it may be GI problems. How many of you have heard of leaky gut? Yeah, lots of you. So leaky gut means, well, let's back up. Your GI system is the whole, all the way from your mouth to your bottom is a tube. And that tube is supposed to let stuff in that it needs and not let stuff in that it doesn't need. So when you eat, food is broken down, and then in your intestine, it's absorbed. But only what we need is absorbed. Stuff we don't need and don't want is not absorbed, okay? And to do that, there are these cells that line the intestine, and they're just right next to each other. And that's your barrier. And if you didn't have that, you would be done, because there's all kinds of stuff in your food that we're not supposed to be absorbing. So like in a way, the inside of your gut is like the outside of your body, okay? So many kids with autism have what we call leaky gut, is that barrier isn't there. Or it's there, but it's not working right. So it lets stuff in that shouldn't be coming across from the inside of the intestine into the body. Then it gets absorbed into the bloodstream and it gets carried all over. One of those things that it probably lets in is proteins that shouldn't be let in. Your body is supposed to break down all the proteins and carbohydrates and fat you eat into little tiny molecules. And then those can be absorbed and they don't do any harm. When bigger proteins get across, they can cause a reaction, so it's not supposed to happen. So anyway, in this study, 43% of kids with autism had leaky gut, and none of the controls, none of the kids without autism. They did another study, and 36% of the kids with autism had leaky gut. And interestingly, their first-degree relatives, their close family, 20% of them had leaky gut too. So it seems like it might be a genetic thing that's passed through, but it has to combine with other problems before it actually becomes autism. So leaky gut is very real. But again, notice 40% of kids with autism had leaky gut. That means 60% of kids with autism didn't have leaky gut by this study. And that's what emphasizes what I was talking about before. All these kids are different. So anything, I can't answer any questions right now. Sorry. I will answer questions at the end. So anything that we do or anything we say about kids with autism is only going to apply to some of them and not all of them in terms of these specific problems. They also, kids with autism tend to have abnormal gut bacteria. So everybody has millions, billions of bacteria in their colon. They're extremely important. We can't live without them. They do lots of very important things with them, and there's many, many, many kinds of species in our gut. And how many here have used probiotics? Yeah. So probiotics are bacteria. They're the good bacteria in our gut. In a very oversimplified way, you could say that people have good bacteria in their gut and bad bacteria. That's way too oversimplified, but you can think of it that way. Kids with autism tend to have abnormal gut bacteria, and that makes a big difference. It changes how we absorb things. Your gut sends signals straight to your brain there is lots of evidence that your gut is like a second brain. It's called the gut-brain connection. And signals coming from your gut go straight to your brain. And when those bacteria in your gut are not right, when they're not normal, that can change the signals that go to your brain. And some of the things that can change gut bacteria, it forms very, very early, gut bacteria. Usually by the time a child is 2, it's established. And one of the things that makes it change is antibiotics. So when a child before a year old gets lots of antibiotics, the antibiotics kill what they're supposed to kill, right? Which is, maybe the bacteria in your ear that are causing an infection, or the bronchitis, something like that. But they kill lots of the good bacteria. So when we're adults, it probably doesn't matter much. We can take some probiotics, and our bacteria will get back to normal. But for little kids, for babies, that may change how they form their whole bacteria, which is going to be hard to change for the rest of their life. So you want to really avoid antibiotics unless they're absolutely necessary. Now, sometimes they are, but I think too many docs are giving out antibiotics for colds and other stuff where they really don't need to happen. So when you go to your doctor, a child with a cold or something, if they recommend an antibiotic, make sure they're not recommending it just to make you happy. Because that's why doctors do it. They know. But they think that you'll be happy if you get an antibiotic. So also, when there's a C-section, that can change because the baby doesn't get the normal bacteria from the mom. So lots of things can change that. There's not a lot we can do right now about children with autism having abnormal gut bacteria except probiotics and having them eat fermented foods. Fermented foods people have used these for millions of years, and they support a normal, healthy colon. So what are fermented foods? Yogurt, kefir, kimchi, sauerkraut, miso soup. So there's all kinds of stuff that can actually support that. This is a really interesting study where they've actually been able to breed mice that have autism. Which is kind of funny if you think about it. And what they did with these mice is they gave them one good bacteria, one probiotic bacteria, and it completely changed their autism symptoms. Just one. Now, unfortunately, we're way more complicated than these autistic mice, or it would be easy to fix everybody. But it just goes to show how important the gut bacteria can be. So, another problem that many kids with autism have is abnormal immunity. And sometimes they have autoimmunity. Autoimmunity is when your body starts to see things in your own body as the enemy. Our immune system is supposed to be able to pick out the things that are the enemy, like viruses and bacteria, and take care of it, and things that are not the enemy. If you have an autoimmune disease, you sort of pick out things in your body that actually are the enemy, and you make antibodies to them. Perfect example of that is rheumatoid arthritis. Your body thinks your joints are the enemy and starts destroying them. And even allergies are a little similar. And allergies it's not your own parts of your own body, but when you have allergies, your body thinks that just simple things like grass pollen or some dust or wheat is the enemy, and it makes all this inflammation when it sees that stuff. So lots of kids with autism have problems with immunity, either allergies or autoimmunity. In this study, kids with autism had antibodies to their own brain. They actually were seeing their own brain as the enemy in some sense and making antibodies against it. Now, we don't know what those antibodies did, if anything, but it's definitely not a good thing to be making antibodies to your own brain. And as you can see, none of the people, or hardly any of the people who didn't have autism, had those kind of antibodies. So one thing, remember I was talking about kids with autism or having inflammation in their brain? It could be these antibodies are causing this sort of cycle of inflammation in kids with autism. That may be one of the things that's going on. We don't know. That's just the theory. I was talking about mitochondria. Mitochondria are the little energy cells in energy factories in everybody's cells. Every single cell in your body has mitochondria, and that's how you have energy. People who have serious mitochondrial diseases, it's fatal. They usually die by age 3 or 4. But turns out that many kids with autism have these really mild mitochondrial problems. And those kids tend to be very low energy. If they're tired a lot, they have regression if they get a simple cold. And if they get sick a lot, and they're really out of it when they get sick. And in this study, they showed that 7% of kids with autism had some kind of mitochondrial disorder that you could identify from a muscle biopsy, which is the way you do it. And in the general population, it's 0.01% instead of 7.2%. So that's a huge difference. But again, only 7% of them. Another thing that happens with kids with autism is they have something called oxidative stress. That means, you've all heard of antioxidants, probably, the things that are in vitamins. It means they don't have any antioxidants. Anytime you do anything in your body, when your enzymes work, when you digest food, when you move, when your muscles move, it causes oxidation. That's how it happens. The oxidation changes the chemicals. And there are byproducts of oxidation that are bad for you. But it works out okay because you have all these antioxidants in your body and you take care of it. And everything's in balance. You oxidate things, you have antioxidants, it's this nice balance. It turns out that many kids with autism are under oxidative stress. They don't have enough of the antioxidants, or they don't use them well. Something's wrong with how it happens. So they have oxidative stress. And this can cause lots of symptoms. And the way you treat that is by giving lots of antioxidants, which could come in multivitamins, which could come in lots of really good nutrition with fruits and vegetables. Of course, they don't always eat what we want them to eat. Never, exactly. Although, again, kids with autism are different. I have kids in my practice with autism who eat anything you stick in front of them. And then I have other kids who are so hard that we could hardly do anything with them because they just only eat what they want to eat. So that's good. From that theoretical basis, let's go to treatment. So as I said, the conventionally based treatment are ABA, speech, physical therapy, occupational therapy, sensory integration therapy. And those are all really important to do. And I'm sure there's other conferences here right now talking about how they work and how to get that to happen. There's medications, but unfortunately there's no medication so far that's actually effective in treating the core symptoms of autism. In other words, it's not going to make their language better. There's no medicine that's going to make them socialize better and be more interested in people. There's no medicine that's going to make them stop repetitive behaviors. However, there are some medicines that can help sort of related symptoms. Like if a child with autism is extremely explosive and behavioral methods don't work, there's things you can do about it. There's some medicines that might help. If a child is incredibly hyper, there's some medicines that might help. Although kids with autism have odd reactions to the usual medicines we use for hyperactivity, so I'm not that fond of them, but it can help. Anxiety, some kids with autism are incredibly anxious, and sometimes anti-anxiety medications might help, but they don't fix the core symptoms. Speech therapy, almost everybody knows that it helps, and I recommend it. Intensive behavioral therapy. I would have one comment about this. This is the one therapy that's been the most studied. It really does help for kids with autism. And the one that the powers that be, the government, the insurance companies pay for is called ABA. And many of you, I'm sure their kids are getting ABA. That's not the only kind of intensive behavioral therapy. And in fact, there's ones that I think are much better for certain kids. Some of them are called Floor Time or Denver Early Start. And the problem is you can't get anybody to pay for them. But my one word of advice is some of the ABA therapists actually know something about these other kinds of therapies. And I would really encourage you to find out more about them. More time in this lecture. I would encourage you to find out more about them and ask the people who are doing your therapy if they can incorporate some of those methods. The problem with the ABA, especially for the sort of higher functioning kids, it's very behavioristic. It's kind of like animal training. You know, you do this and that happens, you do this and that happens, and you get a reward, you know, or you don't get a reward. Whereas things like Denver Early Start, it's more going to where the child is and relating to them at that point and sort of moving them along. So I like them better in some circumstances. It's good to ask. OT and PT help. Sensory integration can help. People often talk about sensory issues in kids with autism. Do they have sensory processing disorder? As far as I can tell, every single child on the autistic spectrum has sensory processing disorder. I mean, it's just part of the situation. They don't process sensory information in a normal way. So you don't even have to worry about if they have SPD or not. We don't know, unfortunately, we don't have any magic for SPD except the kinds of therapies that we've been talking about, especially sensory integration therapy. There's no medicine or food or something that's particularly good, but they all have it. So what about kind of alternative treatments? And it turns out that there are many kinds of alternative treatments, and I want to distinguish between two things. So alternative therapy can mean anything. It could mean acupuncture. It could mean homeopathy. It could mean crystals. It could mean, you know, all kinds of weird things. And some of those really work and some of them don't. But the kind of alternative or integrative therapy I'm talking about, most people call biomedical therapy. And that's because it's all based on biology. It's usually food and nutrition and herbs and vitamins and things like that that have been at least studied somewhat. And so that's what's called biomedical or biologically based therapy. And where I work at Osher, we have acupuncturists and people who do, you know, body work and stuff, but that's not the kind of alternative therapy I'm talking about with autism. I'm talking about biomedical therapy. And in this study, more than half of parents are using this, so it's very, very well known. And these are some of the things that we use. The things in red, in blue, are things that I use most of the time. The things in red are things I rarely or never use. And we'll talk about all of these. But I want to talk about the first child I ever treated this way, because cases are, you know, how we learn. So I was in the very beginning of my integrative medicine practice, and this was back in 2001, and there weren't really very many kids with autism around. We just, you know, I'd been in practice for over 10 years, and I maybe had a few children with autism, and I didn't really know much about what to do with them. They went to somebody else. And I saw this 4-year-old came in, and he had classic severe autism. He was walking around going like this the entire visit. He never said any words. He had chronic diarrhea. He never had a form stool in his whole life. And he'd been doing ABA and speech and all that stuff for 2 years. And this child's mother said to me, I would like to try probiotics and fish oil and a gluten-free, casein-free diet. And very honestly, I thought she was crazy. I had no idea those things might work. I didn't know why they should work. I thought autism was simply a brain abnormality. But I thought, okay, how could it hurt? I'm supposed to be an integrative doctor here. So this child, that's what we did. Probiotics, fish oil, and the diet. In 1 month, this kid came back dramatically better. I literally couldn't believe it. This kind of stuff was 75% better. He was more awake. He was less obsessive. He had normal stools. And everybody in this parent's life was going, what happened? You know, the speech therapist, the aunts, the uncles, whoever they saw, it's like, what did you do? And that's when I realized that something something was working there. There's something that could work in these children, because there was nothing else that changed. They'd been in therapy for years, nothing else had happened. And I actually got to follow this child for another couple of years. And when I last saw him, he was speaking in sentences. He could tell you a story about what happened at school. He was much less hyper. He had good eye contact. He was mainstreamed. Now, he still had autism. I don't want to act like he was cured, but he was so dramatically better. And that's what sent me down this path. Does everybody with autism react that dramatically? Absolutely not. In my experience, when I use biomedical approaches, diet or whatever, a third of kids have really strong to dramatic improvement. Another third have sort of mild to moderate improvement, and then another third may really hardly improve at all, or maybe a fourth. So you just don't know. And that's because, as I said right at the beginning, their biologies are all different. So the first thing that I do with most children with autism, when it's possible, is a gluten-free and casein-free diet. I don't know why kids with autism are so sensitive to these foods, but they are. And many kids with autism will improve in dramatic ways or moderate ways as soon as you get the gluten and casein out of their system. They need to be on it for at least 2 months, completely strict. If you don't do it strictly, you might as well not do it at all. So sometimes people tell me, yeah, well, we did a gluten-free, casein-free diet, but he was getting gluten at school. Well, you might not as well have bothered. Some docs say it takes 3, 4, 6 months, but I mean, to me, there's only so much you can ask of people. But 2 solid months of gluten. I usually make them soy-free as well, because soy can be a problem. And I know that these are really difficult, because what do you do? What are they going to eat? Some kids with autism are really, really hard to change. Now, I will say that for most kids, even kids with autism, when you do a diet like this, you just say, you offer them the food you want them to eat, and then they eat it or they don't eat it. And if they don't eat it, they don't eat, and then they eat at the next meal. And I would say about 90% of kids with autism will actually eat enough and not lose weight if you do that. It's hard, but they will. Now, there's another 10% of kids with autism who just, if you don't offer them what they want, they won't eat, period. They'll just waste away and lose weight, and then you can't do it. But, I mean, a lot of people don't think their children will eat other stuff, but they will. And a lot of times, instead of, I know that buying gluten-free bread and you know, all these fancy milks and stuff can be really expensive, but you don't have to give them any bread at all. You don't have to give them milk at all. And if you work with myself or you work with a nutritionist who understands this, you can just simply take that stuff out of the diet without buying lots of expensive substitutes. Actually, even some kids with autism, I put them on what we call a paleo diet, which is just basically meat, vegetables, fruits. And don't even give them any grains, and then we don't have to buy anything extra. So it works a lot, doesn't work for everybody, worth trying. Fish oil is a very simple thing. A couple of studies show that fish oil, which provides omega-3 fatty acids, which are very, very good for the brain, can be helpful in autism. I recommend it for everybody. This is just a meta-analysis. It shows that it did a bunch of trials and there is an effect. And then vitamin D. There's been really interesting stuff about vitamin D and autism. And that's really important for everybody, but especially around here, because people have low vitamin D levels around here. Do you know where you get your vitamin D from? The sun, that's right. How much sun is there around here? Sometimes not a lot. And the interesting thing about San Francisco is when it's sunny, it's often not very warm. You know, in other places it's sunny, it's hot. Here it's sunny and it's cold and windy a lot. And so people have full-length clothing on, so they still don't get the vitamin D even though the sun is out. So many, even just everybody, but has low vitamin D around here. But kids with autism, it turns out that moms who are low in vitamin D have a much higher risk of having children with autism. And so pregnant women really need to take vitamin D and make sure their level is high, which means they got to go get it checked. You have to ask your doctor to have it checked. And many children with autism are deficient. And in this study here, they gave a very high dose of vitamin D, 5,000 units a day to kids with autism, and they found that they improved. And that's a very simple thing, very cheap. In fact, often you get it through your insurance, and can be effective. This is a more complicated one. It turns out that kids with autism have metabolic problems. Metabolism is how you use all the chemicals in your body. And the sort of one of the most important things that happens in your body is this thing called methylation, where your body puts a methyl chemical group onto something else. It's kind of heard it referred to as the oil in your engine, the methylation. It makes everything happen. And many kids with autism don't methylate well. They don't, and one of the things they don't methylate is the vitamin B12. Now, vitamin B12 is an absolutely essential vitamin. And unless you're a vegan, you probably have plenty of vitamin B12. It comes in meat, dairy, everything. But you can't use your vitamin B12 unless you methylate it. If you don't methylate it, you get oxidative stress, which we were talking about before. And so what we do is we give already methylated vitamin B12. And that is one of the most effective treatments I have ever seen for autism. At least half the kids I give methyl B12 their parents report a significant improvement. Here's the tricky part. It has to be given by an injection. It's given by a subcutaneous injection every 3 days at home. Oh, God. Whenever I say that to families in my office, their first reaction is, oh, God, oh, my God. And 95% of them do it without a problem. It comes in this little tiny insulin syringe. The needle is about that big. You just get it kind of under the skin. And after a while, people just get completely used to it. Mostly they give it when the kid's asleep. Just go bloop in the butt, and that's it. So, and it really can be incredibly effective. People have tried taking it by mouth and by nasal spray and things like that. I've never seen it be as effective as the shots. The only other problem with the shots is that they're not covered by insurance a lot. So that can be an issue.
What does methylate mean? Methylate. What does that mean?
Methyl?
Methylate.
Methylate. What I was saying, methylation is when your body adds a methyl group, it's this chemical group, to some compound. In this case, your B12 is running around your system, it goes into the cells, then it gets methylated and becomes methyl B12. Okay. Another thing which we've found which is very related is something called folinic acid. Remember we were talking about folate in the B vitamins? Well, folinic acid is the activated form of folate. And it turns out that folinic acid can really help kids with autism with their language. And they did a really good big study, and it very much helped these kids. Now, the good thing about folinic acid is it comes in a little pill you only have to give twice a day. And it's something we use in conventional medicine, so you can get it through Medi-Cal from a regular pharmacy. So that's one that's much more practical for a lot of people than the methyl B12. And I found really good luck with that. I think we talked about probiotics, how important they are, and you can give probiotics. There's many, many kinds out there, and you have to be careful to get a good variety, but we don't really know what the best brands are of these things, but I like to have probiotics that have billions of organisms, like 10, 20, 40 billion organisms, and that have a lot of different ones, like 6, 8, 10 different organisms in it. And you can get these from lots of stores, Vitamin Shop, and I won't go into all the brands now. I do if I see people in my practice. But they're really important. And like I said, give fermented foods. Whatever kind of foods your child eats. Try and find something fermented that they will eat. Now this is pretty funny. Turns out that broccoli sprout extract is good for autism. Broccoli sprouts have something called sulforaphane, and this is an important antioxidant. So again, back to that oxidation thing. So if you give this broccoli sprout extract, it turns out it helps some kids with autism a lot. Now, this is not like eating broccoli. This is like eating 2 pounds of broccoli a day, which like nobody's going to do, right? So you have to get the extract, but that is available. I'll skip this slide. One more thing that's kind of interesting, and this is actually not so much of a nutritional therapy, but it turns out that there's something called oxytocin, which is a chemical that we all have in our body. It's a hormone, actually. Oxytocin is what actually makes you go into labor. And in fact, if you don't go into labor, some of you got Pitocin, right, to make you go in labor. That's oxytocin. So oxytocin works like that. Women have more of it than men. And it turns out it's also the social hormone. People who have more oxytocin are just more socially positive. Even if you give extra oxytocin to, say, college students, they'll be more social and more positive. So people got the idea that if you were to give oxytocin, it might help kids with autism with their socializing. And there's been a few studies on it, some of them from Stanford, and it shows to an extent that it works. It's given as a nasal spray. So that's a sort of summation of a number of the things that I use to help children with autism. I want to talk about some of the things that I don't use, especially chelation, because a lot of people with autism or parents ask me about chelation therapy. Chelation therapy is based on the idea that you have kids with autism have lots of heavy metals in their body, things like mercury and lead, and they're stuck there and they can't get rid of them and they're causing problems, which is possible. The problem is, and chelation is, you give these chemicals, not nutrients, not natural things, but actual chemicals, and these sort of lock onto these heavy metals and they go into the bloodstream and then you pee them out. And they do lock onto these heavy metals and you do pee them out. But there's a couple of problems with it. Number one, it's really hard to tell which kids with autism have a problem with these metals because they're not usually running around the bloodstream. So just doing a blood test is not really good enough. Number two, you don't know if you're taking those metals from someplace that the body has them that is safe, running around in the blood and putting them someplace that's not so safe. And then they rest there and only some of them get peed out. And I worry about that. And number three, it also can cause, it not only gets the bad heavy metals, it takes out lots of things, sodium and potassium and all those things. So you have to be careful to watch for electrolyte problems. So I don't use chelation therapy. I know some people who do. Some doctors who do biomedical therapy use it. Some people say it really helps, but that's just my position on it. There's also hyperbaric oxygen. That's when you go into like kind of an oxygen, into like a tank, where you can put oxygen under high pressure or air under high pressure, and that means it can hold more oxygen. And the idea is if you give more oxygen, then it'll help the brain. There's one study that seemed to show it helped, and then another good study that showed it didn't help. It's very expensive. This is thousands of dollars, and it's relatively safe. Sometimes people will pop an eardrum or something, but I just don't think it's that helpful, and I don't recommend people do it.
HBOT?
Excuse me?
HBOT.
HBOT, right. It's called HBOT. So one of the things I wanted to talk about is how much evidence there is for this kind of treatment. All the treatments I've been talking about. If I compared, let's say, how much evidence there is for using penicillin for a strep throat or a blood pressure medicine for high blood pressure, there's tons of evidence of that. How much evidence is there for what I'm recommending? Often only 1 or 2 or 3 studies. It's not the kind of evidence that we would love to have. and I would be the first to admit that. So why do I use it anyway? Well, why is there so little evidence? First of all, because this is a new way of looking at autism and people are just starting to come out with these studies. Secondly, because who's going to fund these studies? Most of the studies you see out there in the real world are funded by pharmaceutical companies, right? So Ritalin, there's 1 million studies about Ritalin. Why? Because that's who studies the Ritalin manufacturers study them, and they pay doctors to do them. Most of what I'm talking about here is vitamins and minerals. No pharmaceutical company or anybody else is going to pay doctors to do that. So it has to come from grants from like the National Institute of Health and things like that. And it's really hard to get those grants. So funding is a huge problem for studies that don't involve these pharmaceuticals. And so that's why we don't have as much research as we want. But I feel like the reason that it's worth doing, even if we don't have all the research, is we're usually using very safe things here. We're using nutrients, we're using vitamins or derivatives of vitamins, we're using minerals like vitamin D. We know a lot about vitamin D, even though there's not studies, lots of studies about vitamin D in autism. So I think it's worth doing, even though the research isn't where I'd like it to be. Also, there's no other treatments that we're substituting. It's not like there's other things we can do, and I'm saying do this instead of that. I'm saying go ahead with all your therapies and then try these things and see if they work. So it's not like I'm saying, oh, like if it was ADHD, I might be saying do this instead of using Ritalin. Okay, well then I really ought to be able to prove a little better that it's helpful. But in this, there's not anything else besides the therapies. And my question is, I've been saying that maybe, 30, 50, 60, 70% of people might improve. What if it was only 10%? What if, like, say, the gluten-free, casein-free diet? If 10% of kids with autism had a really strong improvement and had a better life from that diet, wouldn't it be worth everybody trying it, even for that 10%? 90%, well, it didn't work. It was a pain for 2 months, and that was it. So that's kind of how I feel about this. Now, what about dangers? A lot of conventional docs make a big deal about how dangerous these treatments might be, but it's mostly not true. Diets, like the gluten-free, casein-free diet, if somebody is helping you with that, it is a very safe diet. There's not very much in gluten that you need at all. All it is a carbohydrate. And dairy has calcium, and it has some protein. So you want to make sure if you're on that diet, you have some other source of calcium and you have some protein. But besides that, you can do very well without dairy. Most of the world does quite well without dairy. We're actually one of the few civilizations that drink milk after infancy. You can get toxic if you take too many vitamins or minerals. And this can happen if people go to too many doctors. Like when I recommend vitamins, I'm not recommending toxic levels. But I have come across people who've been to 5 different doctors who do this kind of thing, and they add vitamins and minerals at every single doctor. So now they have like this giant bag of supplements, and they maybe have 6 different sources of vitamin E that they're taking, way more than they should be. So that's something we need to be careful about. Like I said, chelation therapy can be dangerous. And then I didn't talk about any of these, but if you look out on the web, I mean, there's hundreds of very weird therapies, and I encourage you all to not do them. One of the things that happen is people suggest you should use these pharmaceuticals for autism that have never been shown to help autism. And pharmaceuticals can have really negative effects, so you have to be careful about those. There's all kinds of strange things out there, getting sheep cell transfusions, and it's really worrisome. But if you deal with somebody who just knows what they're doing, those aren't problems. I wanted to talk about finally a few sort of, when I say I practice integrative medicine, it's not just all this biomedical medicine, but it's also looking at the whole child and kind of seeing what's going on in their life that might affect them besides just these autism treatments. And one of them, I can't tell you how important it is sleep. How many of your children have sleep problems? Yeah, a lot of them. And not only is that not good for them, because when kids don't sleep, they don't function well. When adults don't sleep, they don't function well. And kids with autism really have sleep issues. Either they won't fall asleep until 10, 11, 12 o'clock at night, or even worse, they get up at 2 or 3 in the morning and they're up for hours. And this is really important to take care of. So first of all, there's simple what we call sleep hygiene. That's making sure that the electronics go off an hour before bedtime and you have a soothing bedtime ritual and dim light, and just like any other kid, you'd get them ready for bed. And then there's behavioral techniques like you'd use for any kids with sleep. You might be telling them stories and that kind of stuff. But sometimes that doesn't work. And one of the things I found that works dramatically is melatonin. Melatonin is the hormone that makes us go to sleep at night and wake up in the morning. We all have it. It seems like many kids with autism, their melatonin cycle is off. So they don't get that natural urge to go to sleep at a normal time. And melatonin can be a lifesaver. It's very safe. You just give a dose, 45 minutes later they're sleepy and they go to sleep. And it's one of the things I've done that probably I've got more thank yous from parents than anything else. And then when they don't have to stay up till 11 or 12 after a whole horrible day of therapy and behavior and all that kind of stuff. So I highly recommend asking somebody about that. And the only thing it doesn't do, it doesn't keep people asleep. It helps them fall asleep. But if you have the kind of child who's waking up at 2 or 3 in the morning, that's going to require different therapy. It won't keep them asleep all night. There's something called 5-HTP, which is a supplement. It occurs naturally, and that can help them sleep. And sometimes I'll even use medications like clonidine because I just think it's really, really important that kids sleep at night. Their function just isn't as good. Anxiety is, I think, a really, really big problem in kids with autism. I've seen a lot of times, yes, they have their core behaviors, but they get so much worse in certain situations in which they're anxious. That might be school or going outside or being in the presence of certain people, and they just cannot handle the anxiety of it. And there's lots of ways to treat that. In the higher functioning kids, you can even use kind of mind-body medicines like biofeedback or hypnosis. But there's certain herbs that help anxiety, and one that I like a lot is called inositol. This is a simple sugar that occurs in lots of foods, but given in larger amounts, way larger than you'd find in food, it can actually help with anxiety. I find it works about half the time, which is pretty good. And most biomedical doctors know about that.
Isn't it SOS? Is it a prebiotic?
No, it's not a prebiotic. This is for higher functioning kids. You can even teach them relaxation breathing, which can be really helpful. As many of you know, animal therapy can be really good for anxiety, hippotherapy, horse riding, horseback riding. So, my overall recommendations are to continue the conventional therapies you're already using. Always ask about what biomedical therapies might be helpful, and consider starting to look at some of the safer kind of biomedical therapies and use them with your children. So, the summation is kids with autism are very different from each other, but many have gastrointestinal or immune or allergic problems that we can work with, and often this treatment can improve the major symptoms of autism. Most of these are nutritionally based and safe, but it is really important to work with some type of doctor or provider who can help you with this. There are certain things you can do on your own, like say fish oil is pretty safe, but even that, to give the right dose, the right amount, you have to know what you're doing. So I would really urge you, there's lots of doctors who work with this and other providers besides doctors, and I would really urge you to find somebody who's experienced and can help you. And finally, so I work at the Osher Center at UCSF, and I do see kids on the spectrum, obviously. And we take Medi-Cal and just about every other kind of insurance, except if you have an HMO. And you're free to call up and see if you can get an appointment, or you can get an appointment. Question is when. So I'm booked about 3 or 4 months out right now, but I work with Dr. Blockman, who does exactly the same thing I do, who's younger, who I've trained to do this, and she's much more available. So if you're interested, you can just call that number. Thank you. Thank you. Okay, so I do have about 20 minutes for questions. So I'll just start at one side and sort of move over.
So what are your thoughts about NEMCheck protocol? Have you heard of NEMCheck?
I've heard of the NEMCheck protocol. I've never seen any research that made me think it works. It doesn't mean it doesn't work. It's just not one of the things that I use. Yeah.
Have you seen improvements in older patients taking your methods for the first time, say, for example, if they're like teenagers as opposed to a young child?
Yeah, that's a good question. I'm really glad you brought that up, in fact. Yes, you can see, oh yeah, let me repeat the question. The question was, can you see improvements in older children? Let's say a teenager who for the first time will try some of this therapy. The answer is yes, you can see improvements. But there's a but. The but is the younger the child, the better the chance of dramatic improvement. So I urge anybody to get, if who has a child, you want this kind of treatment, to get in as soon as possible. The earlier the better. I am always so happy when I find somebody who's a year and a half, 2.5, rather than 10, 12, you know.
Which fish oil do you recommend and how much to give? And when it comes to fruits, meats, and veggies, can I also add beans to that?
Okay, so which fish oil? There's 2 brands I like. Carlson fish oil, I think, is a real good brand. It's reasonably priced, and you can give a teaspoon of that just about most anybody, unless they're really little, in which case you give half a teaspoon. And
Is it Carlson?
Carlson, yeah, and it's available online. It's available in stores. What was your second question?
About my daughter loves beans.
Oh, beans, yeah, if you do that, yeah, beans are okay on that diet. Yeah. Yeah.
I have 2 questions for you, actually. You mentioned trying to avoid antibiotics. Like, until what age? Like, what age would you say the gut is kind of formed? Or
Usually the gut is formed by age 2, maybe 3. But of course, on the other hand, I think you should avoid unnecessary antibiotics always, right? But then it's more important. What was your second?
and then the second is for melatonin, if you had a brand, especially liquid melatonin.
Yeah, there is Source Naturals. Source Naturals is one. Melatonin doesn't matter so much which brand. I mean, they're all just melatonin. And I start with like 0.5 milligram. And then you can go up to like even to 5 milligrams if you need. Just go up sort of slowly until you find what works. Yeah.
Do you know of any clinicians in the East Bay that do this type of work?
I know there probably are some, but I don't know them. If you were to Google biomedical treatment of autism, you'd find all these people. It's not that hard. They're not hiding. Yeah.
How many of the interventions have medical tests you can do to see if it'll help you or not? Or do you just need to try?
Almost none.
Almost none.
Now, the question was how many of these interventions have a test that show whether they're going to work? And the answer is practically none. However, some of them have a test that shows you that it might be needed. For example, you can test vitamin D levels, and if they're really low, you go, well, more likely it's going to work. But none of them like that. Yeah.
The leaky gut. How do you find out whether your kid has leaky gut or not?
Well, mostly there's a sort of a fancy test you can do, but it's kind of expensive, and most of the GI doctors won't do it anymore. I just go on the assumption that if you have chronic constipation, diarrhea, any of that stuff, you probably have leaky gut, and move on.
And then the substitute for milk. What's the best?
So there's flax milk. There's a pea protein milk called Ripple. There's almond milk, but you have to watch almond milk. If you're needing the protein, almond milk doesn't have much protein, but there's high protein flax milk. And I would advise people to stay away from rice milk. We used to recommend that a lot, but now it turns out it's got too much arsenic in it.
Okay.
What's that?
Rice milk. Stay away
Too much rice milk is not good as too much arsenic.
The flax milk is their best substitute.
Yeah, it's a really good one. Flax milk, high protein flax milk is very good. Yeah.
So three questions actually. So one is, if this topic is so important, how come there is such a limited research on this topic? Because even when you showed the slide, you said there are only 2 research studies and 1 research study. So
It's just what I said. It's first of all, it's new, and second of all, it's hard to get the funding because pharmaceutical companies won't fund the research.
okay, just second.
Maybe one more, because there's lots of people.
So you also mentioned that prematurity may also cause autism.
Yeah.
So what could be the link between prematurity and autism? Is it just the development of the brain?
Probably brain development. Probably the brain being exposed to outside the uterus too early. Prematurity, people who are premature have higher incidence of autism, of learning disabilities, of ADHD, so it's not surprising. Yeah.
What do you recommend as a substitute for like pill form vitamins with, I know like a lot of kids with autism have problems swallowing.
Oh yeah, most kids, the question is, what do you do when they can't swallow pills? So most everything I do comes in powders or liquids.
So with the vitamin D.
Oh, vitamin D is easy. It comes in drops. One drop has 2,000 units.
And then what are your,
Oh, but let me tell you one more thing. And sometimes it comes in pills and you just crush them and put them in something. You know?
and then when do you think of Pediatric as a,
The question is, why are you using Pediasure? So people use Pediasure. Look at the first ingredient in Pediasure. Sugar. So I don't like Pediasure at all. I think it's a junk food. On the other hand, if kids are losing weight and absolutely have to have it, then sometimes there's great substitutes, but they all cost some money. There's much more healthful things in Pediasure out there. So only use it if you really have to. You don't. How do you know if your child isn't methylating well? You really can't know. Yeah.
People ask about fish oil, looking at natural sources of omega-3 fatty acids like actual fish, obviously sardines, anchovies, wild salmon. But what are some other sources that are safe in terms of having low?
I think she's asking, how do you get omega-3 fatty acids from fish and other sources? And you've actually just named all the good ones. Sardines, salmon, anchovies. So yeah, that's kind of about it. I mean, there's not a lot of others that are safe because the other fish have high levels of mercury. Yeah.
Yeah, doctor, I used to use the probiotic and liquid instead of the tablet because I don't know why, but some people say that it's not the same effect. Is that true? The liquid and the tablet?
No, they should have the same effect.
The same effect?
Yeah, I mean, the same stuff is inside.
I prefer to use it in liquid, flavor strawberry or, cranberry, blackberry.
Yeah, the problem is some of those flavored ones have artificial colors, which are actually not good for kids with autism either. So, you got to watch that. Yeah. What probiotic? I use lots of them, but one that's reasonably inexpensive is called Nature's Way Primadophilus Optima. Primadophilus, like Optima, by Nature's Way. Yeah.
So for the malnutrition, my child, he doesn't sleep until 2 or 3. I would like to know, is it over the counter or prescribed by doctor?
It's over the counter.
He couldn't sleep. Do I just take it right away, like at 2 or 3 o'clock? Does it work right away? Or?
You can use it. You can't just give it at 2 or 3 o'clock. Yeah, you can try it. Sometimes it makes him sleep too long, though, if you give it that late. Yeah.
my son has been on the gluten-free diet for 5 years. Do you recommend it for lifetime or?
Okay, so this is a great question. She said her son has been on the gluten-free, casein-free diet for 5 years, and how long should they stay on it, right? Well, did it help?
Yeah, it helped tremendously.
Tell us what it did, just so other people can hear.
He had a lot of sensory issues where he didn't want to have eye contact and he get physical with himself. And within like 3 months of the diet, like he didn't do that anymore.
Yeah.
And he became really verbal and he's a lot more high functioning.
Right, good. So you saw this is a really, really powerful effect of the gluten-free, casein-free diet. So how long do you use it? I find that often kids don't need to be on it forever. And after 5 years, I would probably start introducing gluten a little bit at a time and see how it goes, because sometimes the gut has healed. So it's no longer so sensitive, and then many times you add that back and nothing happens. And then if it does, you can just take them off again. I want to say one more thing that I forgot to say. So as I said before, if somebody has one child with autism, the risk of another child, the second child developing autism is higher. One study, it was like 7 times higher. Now that still only makes it like 7 out of 100. Doesn't mean you're likely. But there's 2 doctors I know of who have whole practices full of autism, primary care practices, in which for many years, no second child has been born with autism. So they've decreased the rate of that second child having autism. And how do they do that? They recommend really simple things, that moms take their prenatal vitamins, that they take fish oil, that they take probiotics, that they stay away from any kind of pesticides. And then when the baby is born, they go on with the omega-3s and the prebiotics and breastfeed, and they are very careful, if at all possible, not to take antibiotics. So all those things are things I would recommend for anybody even thinking of having another child, because we're not sure at what point in pregnancy this becomes important. Yeah.
So I was wondering if, you said there's a small percentage of people that they know there's a genetic link.
Yeah.
In your experience, have you had too many experience with those patients?
So the question is, in a small percentage of patients, that you can actually identify a gene that's associated with autism.
Yeah, well, I have a second following up to that. Like, so if that patient has that gene that they associate, do you know if these have been effective?
And does that affect how effective this treatment is? I don't know. You know, I haven't had enough so that I can say, you know, generally it works better, generally it not. But I would just do the same thing. Yeah.
So, what is your view on stem cell therapy? Do you
Oh, yeah. Question is, what's my view on stem cell therapy? So stem cells are cells that haven't differentiated to form the function they'll usually do. In other words, become liver cells or this kind of cell or that kind of cell. And you can inject stem cells and hope to get an improvement. The research on that is very early. I've never done it. I've never had a patient with it. But if you wanted to sign up for a research study under very careful conditions, then I could do that. Anybody who's interested in studies, being part of a research study, which we have at UCSF, which they have at Stanford, which they have at Duke, you could Google National Institute of Health, autism, and they will show you all the studies that are possible to do. And stem cells is one of the things being studied, and who knows, it might end up working. I have time for a couple more. Yeah.
If he is on ADHD medication, would it be harm if you use the fish oil, antibiotic?
Right. The question is, if somebody's already taking ADHD medication, would it mean you shouldn't do these things? No, it's fine. There's no negative interaction. Yeah.
How do you decide which biomedical treatment to start? I mean, do you hit them with several things at once, or do you have a hierarchy of?
Yeah. So the question is how to decide which biomedical treatment to start. Different doctors do different things. Some of them are like, everything, you're going to do the diet and the fish oil and the methyl B12 and this. I tend to want to be a little more orderly about it, especially with the diet, because if I'm going to start the diet, I want to know that it's the diet that's working and not something else, right? And so I'll usually do that, and then I'll do maybe a couple of things at once and then go on to the next. And I usually see people every 3-4 months, and we just kind of go on, especially the injections. That's another thing I like to only do, because that's really, it's a pain. And so I like to isolate that and see if it's the thing that's working.
Is that a B12 injection?
Yeah.
And how long does that last? Like a couple months?
No, you do them every 3 days.
For your life?
Well, again, you might do them for a couple of years and then see if it still works.
Can you purchase inositol
And acetol.
from the store directly?
Yeah,
Is it
yeah.
prescribed or anything?
No, it's not a prescription. Last question back there.
With the gluten-free, is it important to be careful with what she touch? Like, Play-Doh have gluten.
No. So the question is, can you touch things that have gluten like Play-Doh? And the answer is that's not important. That might be important in somebody with celiac disease, but this isn't celiac disease. I mean, at least I've never seen a case where that turned out to be that sensitive. Okay, great, everybody. Thanks a lot for coming. I appreciate it.